Hello and welcome to another episode of GOA365's Face to Face. Now today we have a very distinguished guest among us. He is the president of the IMA All India, a pretty famous doctor, medical practitioner from Kerala, Dr. R.V. Asokan. Doctor, welcome to our show. Dr. Asokan has been in the forefront of many things. He's been there at the to try and put out what are the issues of the medical profession to the government generally. He's been there, the RG thing, he's been there trying to ensure security for doctors, then the digital healthcare, lots of issues. But I think instead of me saying that, I think Dr. Asokan himself would be the best person to give us what is the general situation, medical situation, all India. Doctor, what is happening in India? Our population is growing, older population is growing, younger population is there, our mortality, the mortality age is gone up, but there are a lot of underlying issues. As we become more prosperous, we face more challenges, I feel, and the full load goes on the medical profession. Doctor.
Yes, health is very important. And we realized it a bit late during the COVID epidemic that health is very important. But a silver lining during the COVID is that whatever, even though it might be slightly below par across the country, the public sector infrastructure and the public sector human resources were the iron grid on which we could stand on the COVID. So if you take the health scenario of India, there is a bright side, there is also a low side. The bright side is that healthcare is relatively inexpensive when you consider it in a global scale. At the same time, healthcare is eminently accessible also, in the sense, if you want to meet a doctor, you can just walk into a clinic, a hospital, when at your convenient time, and the waiting time for emergencies are almost nil. This doesn't happen in the West.
Absolutely, I was going to say that UK and all, for a simple fracture to 2-3 months, people have to wait in line, doctor. It's right?
So, I can very easily say we are one of the best, though we have a lot of reservations about our own health system, how it functions. But if you compare it with many other nations, somehow we have reached a place where, it's possible to meet a doctor, it's possible to get care without much difficulty. But it's also, on the other side, it's becoming expensive. It's also becoming not accessible, not affordable to at least a section of the Indian Medical Association feels that healthcare in India should be driven by public sector.
Yeah, but doctor, let me interrupt you here. But public sector, that is the ideal situation, right? Public sector investment, public sector people, it has to be driven by. But public sector investment today, health services as a rule, the government is like, it's got so many other priorities. So it probably is not putting as much, I'm saying it's not putting enough investment, is not putting even half of the investment is actually needed for public sector. Also, there is a big differentiation between the healthcare probably in north and in the southern states of the. What do you think?
The issue is, for many years, many decades, governments have not invested in health.
At all.
It has been stagnating on around 1.1% of the GDP, all the governments put together. The healthcare expenditure of the country is 3.9% of the GDP. That means 2.8% comes from the private sector. So the leadership has been given to the private sector because of lack of investment, lack of prioritization. One of the issues we find here is it's a state subject. So it is driven by the political will of the states. As you rightly said, the southern states have been doing very well, and including Goa. Yes. Goa has excellent parameters. Goa has an excellent public sector, very good medical college, It doesn't have a private medical college.
No.
So it's rather a role model also. I understand the infant mortality rate of Goa is around 8, which is which is a pride because
It's almost like the Western countries.
because you cannot go below 8 because there are a lot of other congenital and other things which we cannot regulate. Government sector should give competition, tough competition to the private sector.
In Goa, our GMC gives tough competition to all the private sectors because today probably our cardio and even medicine and all is probably better than most private sector hospitals. Not only in Goa, probably even in states like Maharashtra and even in Kerala, private I'm talking because they have the best equipment, everything. But we still GMC still is very good. I don't know, your figures must be telling you.
Yeah, I have heard about this. That is exactly what I am saying. There was a time when the modern medicine was being led by the government medical colleges of the country like Madras Medical College, Calcutta Medical College, and at least the Goa Medical College is keeping that legacy. No longer across the country. It's now led by private industry.
Now that is, industry means commercialization. So today it's become a big issue right now. We are moving like how US was. If you don't have insurance, you can't go for a thing. That's not fair and it's not right also, no?
That's a policy decision where the government missed. It was in 1983 the first corporate hospital was formed in India. From there onwards, it has been the shareholders who are calling the shots, and you cannot allow the for-profit industry to come in and then complain about it. So it should have been a policy decision. Having small and medium hospitals, clinics run by doctors as a profession is one thing, but to have shareholder-held company which has the profit as its sole objective, the whole direction of the healthcare has gone haywire, where we have from the profession we have taken it to the industry.
An industry, I don't know, sorry to say doctor, but a very profitable industry I must say, because this is such a huge population and India is, whether anybody likes it or not, is becoming more and more prosperous, and because of prosperity then you get lifestyle diseases, you have diabetes, you have heart related disease, you have so many diseases. Then now because the huge pollution in many states, now all those releases, so it's an industry, but a very profitable industry, right?
Government also is is not very careful in allowing an insurance industry. Exactly. And coupling it with the hospital industry is going to be a disaster.
But it's happening.
With this, we have been saying that policy decision and reverse direction. Only just 10 years before, there was a document led by Dr. Srinath Reddy in 12th plan, high-level expert group document, where it said the universal health care, a basic package will be provided to every citizen by Government of India. They can purchase care for below poverty line. The government will purchase care from the private hospitals, but they eliminated the insurance. That document eliminates the insurance. But 10 years down the line, now we have Niti Aayog, which has come out with the document called missing middle. What they mean is around 95 crores of people who do not get covered by PMJAY or the 10% which can afford private health care. So they are pushing it to the insurance industry. In 10 years time, the total policy direction has been reversed from government and only the citizens. We have now imposed another third party who has nothing to do with health.
Who doesn't know anything, is not bothered, right? That's what you're saying.
That's what I'm saying.
So this commercialization, once upon a time, like you're a doctor and like so many people, it was like a what do you say, it was like a mission. Today in many places there are doctors obviously are with a mission, but they are controlled by people who are non-medical profession. Now it's a big danger, right?
You have the management gurus sitting on the hospital industry.
They check the balance sheets ups and downs. Okay, I mean that is. Don't you think that's a little dangerous?
I think the government has a role here. It may not be possible to reverse whatever has been done, but the government can take the leadership. It only takes investing more. Even 12th plan for 5% of the GDP. Even 5% of GDP is very modest. Very modest. Very modest. But we are nowhere. We are around 1.1. And actually, the last budget, the Government of India budget, the health actually shrink from 1/3 of the government investment. Central government came down to 1/4 of investment.
Is this because the health is a state subject?
Partially true, but there are vertical programs like tuberculosis. There are vertical programs on many things like immunization. Partly true, but health has to be a state subject to a large extent because the health needs of the population differ not only from state to state but even from district to district.
But doctor, we see a very stark divide here. The southern states are putting in money. Like you see Goa only, like we started a super specialty wing of the hospital. Our cardio is like top of the line. It's better than probably many hospitals even in like supposed to be the developed country. Our doctors are very, very good. They trained abroad and all that. Now we are starting a tie-up for oncology for cancer with Tata. There's some tie-up. So southern states or northern states, that is lacking. Now I'll come back to Calcutta about that, what is happening about a general thing, but northern states, this sort of a thing is lacking. This push is lacking. You agree or
Yeah, I do agree. The public sector is doing well.
Yes, in southern states. Because is
that includes Goa
and Kerala, all these southern, Telangana, Madras.
Goa, 50% of the deliveries happen in government sector. Tamil Nadu and Kerala, it's still better. 2/3 happen in the public sector.
That's very good. So, is that right that southern states are putting in more effort, northern states is a little worse or better? I don't know. Once upon a time, Calcutta was very good, but today Calcutta, I don't know. It's like under spotlight, so as to say.
Health and education, I think the southern states have taken a lead.
Big lead.
A big lead, and they get because they demand. And they watch, especially Kerala during COVID, the government did well.
Very well.
And people rewarded it with another term. So the political benefit they get by investing in health, something which is happening in South, North the issues are slightly different. They are more emotional perhaps, connected to ideologies.
That is political, but actual work was done, and even in Goa, whatever it could have been done better. That is a matter of a debate, but it was done. I feel southern state at least did a lot in that. Now, doctor, I want to just ask you one thing. Now, this insurance, this Prime Minister's overall all India insurance thing. Now, that's a good step because we in Goa we have our own DDSY thing. Is that a good step, bad step? What is the
There are fallacies. The idea is good, but there are fallacies in that one, it is grossly underfunded. We calculate that around 1,68,000 crores are needed for every year. If you want to provide that sort of a care to 5 lakh families, now expanding to 70 plus age group people. But hardly, the money that is being provided is somewhere between 8,000 crores to 12,000 crores.
Nothing.
It's nothing. It's not serving the purpose. And the second thing is that 2/3 of the services are coming from government hospitals. In government hospitals, the services are already free.
Free, exactly. Yeah.
So what is the point in providing PMJY cover where the poor are already getting free service? It is just from one ledger to another ledger they have moved.
Okay.
So what exactly should have been done is that government hospitals should be funded directly by the government. PMJY should have been kept for purchasing care for poor people.
Which was the
original concept.
Yes, okay.
But that did not happen. And with hospitals, around 300 procedures have been banned. They cannot do.
I see.
They cannot do around 300 of the procedures So only certain procedures which are, and there is also a large, huge backlog of payments to the hospitals, especially in states like Punjab, even Goa. I hear that that's the case. So there are, we need to re-envision PMJY.
Challenges.
Yeah, there are huge challenges there.
So one of the biggest challenges in our country is that the huge size of the population. One. Second, the disparity among the population. Like certain states are pretty bad off. Certain states are okay, and certain states are well off. So, like for example, Telangana is pretty well off. Like you talk about Tamil Nadu or Kerala for that matter, even are well off for whatever the reasons. But certain states are okay. Certain states are bad. So that is going to be a huge challenge for the medical profession, given over time, right? Because the population is just going to increase, and the elderly population is going to
increasing. Geriatric care is a challenge.
It's going to be a huge challenge, right, for doctors. Anything that the government and IMA are doing to try and
but
plan for that, I don't think work is not.
We have moved from a lifespan of 27 in 1947. Today it is 27.
27 years?
27.
Wow.
27 years in 1940. That is where Britishers left us. From there we are 71 today. Yeah. Mainly because of better maternity health care services, child health care services, eradication of smallpox, eradication of polio, eradication of leprosy, and now control of tuberculosis. See, many diseases which were affecting the lifespan have been contained. But on the other hand, the lifestyle diseases, because of the...
Yeah, I was going to ask you that.
Yeah.
What are these lifestyle diseases and why you think it has gone up so much?
There is a very interesting theory on this. Because of centuries of poverty and famines, there is a gene called thrift gene.
Okay.
This thrift gene saves all the calories, and whatever food is available, whenever it is, it stores it in the body. It doesn't let go. And this thrift gene is present in all Indian nationals. And when we are becoming prosperous, there is no more famine, there is no more starvation, still the thrift gene is at work. And it goes on saving a lot of calories. So we are particularly for cardiac diseases, we are liable. If you compare with the Western countries, Caucasians as we say, they have low liability for cardiac disease because of this. It will take another 100 years for this thrift gene to disappear from Indian population.
See, I totally agree with this. Why? Because if you look at our not even so many generations, one generation parent, they would always say no, you save, you don't spend. Yeah, no, you because you don't. Then after we had Fiat and Ambassador. Today you have a Porsche and Jaguars and all that.
Same thing happens in the gene also.
Yeah. So that, and food also, people KFC and all this type of food when you go, people who could afford to travel to the US or Europe, they could. But today it's everywhere, every second.
Yes.
So that is probably one of the reasons. What are the main besides cardio? What else are the lifestyle diseases that are...
Especially diabetes. We are becoming a diabetes capital of the world.
Why?
That is exactly the reason. The genetic structure, growing prosperity, and our own lifestyle becoming sedentary. We are no more working in the fields. We are not exposed to the sunlight. So lack of exercise and...
so you need to exercise about 200 minutes a week, I was told.
More than that,
the
stress. The stress has come into the society in modern living, and fragmentation of sleep. Sleep is a very important health component.
Correct.
Stress and sleep, I think they will account for at least 50% of diabetes.
Yes. Okay, and in your profession and my profession, I think that is a given. Doctor, now just to bring it, we are almost out of time, right? Just to bring it on to what happened about this. A lot of issues been happening all over India, all over the country. Starting off, it really it was there before that
RG car.
RG car in Calcutta, but because a lot of attacks on doctors in hospitals, and then RG car, that was really heinous, and lots of these issues. Like, what is the IMA? What is the blueprint for the IMA? Because agitations are going on all over the place. Even in Goa we had. So, what's the blueprint for the IMA to ensure that doctors, which are a very integral part of society, needed, not only needed, are safe? The environment is safe. They can work better. As it is, it's a high stress environment. They are there, in OTs and casualties 24 hours. So, is there something can be done or cannot be done, or it?
Violence in healthcare institutions is not going to go away for another couple of decades at least.
Mindset problems?
Not only the attitude is one of them, but the main issue is the gap between the expectations and the what is deliverable in a hospitals. The huge expectations, the deficiencies in the infrastructure and the human resources on one side, and on another side the out-of-pocket expenditures in a for-profit hospitals, people unable to blend it. And the face of the healthcare anywhere, whether it is in a government hospital as well as corporate hospitals, is a medical profession. So naturally medical profession is a soft target, and the attitude is also one of a consumerist attitude. I have money, I will buy care. That doesn't work that way in health. It's not always. So this violence is there for stay, but lot could be done by the governments.
Like
one, investing in health, improving the public infrastructure, and providing for basic care for everyone, bringing in universal health care. At the same time, the medical education also has gone for a toss, in that the private medical colleges are more now than government medical colleges.
Almost double, I think. Right?
Yeah, not double, but more than what it is, more than the government. But at the same time, the medical colleges, instead of having more doctors to look after the care of the patients, actually what we call them as resident doctors. What happened in RG care is that lady doctor was on 36 hours duty. All these young children, they do 100-hour per week duty.
Which is double what anybody should work actually.
Yeah. This has happened because more positions have not been created to look after the patient care. Now they are using these postgraduates who have come to study clinical medicine as employees of the state. So they, being the lowest of the hierarchy, they are bearing the brunt of it. That's what happened in RG care.
So, but is it going to change? The government has to put in some pressure, get in some infrastructure, perception of the safety of all that has to change. Will it change?
We are expecting, we have high hopes for the Supreme Court. This is the first time that the Supreme Court has stepped in.
Yeah.
And that is a good thing that has happened. So we are keeping the fingers crossed with the National Task Force. So at least we are sure that the basic things will be there.
You are optimistic that,
yes,
but it will take time, right?
Yeah, but what we are missing is a central law.
That is, I think,
because all these things will take care of the large hospitals.
Smaller one.
But
clinic.
a doctor who is in a periphery in a small town can be protected only by a central law.
I agree. I hope, because I hope something gets done, because the medical profession is very important, and the way India is becoming more and more prosperous, and care is what is needed.
Patient care.
Yeah, patient care, palliative care.
It's all about the patient.
Absolutely. So that it's only possible if you manage to put in more investment and more doctors come out and more training and safety. People, why would they join a profession if it's safe? Prestige is one thing, but safe and some sort of satisfaction. Thank you, Dr. Asokan. It was a real pleasure to have you with us in Goa, and I hope we will see you soon again.
Thank you, sir. Thank you.
Thank you.
Thank you.
And keep watching GOA365.